Okay, good afternoon, everyone. I want to thank you for this opportunity to briefly share a pilot project that we initiated between 3 Hudson Valley Hospital libraries. Our title is, as you can see, Tracking Outcomes in a Hospital Library. So what do we mean by that title? Well, we're looking at the outcomes of research requests that come into us. So we want to track those outcomes. And we want to look at the data, do some comparison, and then see if there are differences in context. And what we want to do is glean some insights into both the types of libraries, the hospitals that they're in, and the frequency of the requests that are coming into us. And when we talk about requests, we're talking about the type of research where we need to go into databases and do deeper dive research, not just simple questions, but questions that require us to take the time and fully research the particular topic that's being asked of us. So who are we and where are we located? Well, first up is Frank Appell. He's the medical staff librarian at Good Samaritan Hospital in Suffern, New York. This is a large hospital, 283 beds, but he also answers requests that come from 2 other smaller hospitals, and he is on the phone with us as well. We have Mary Allison Farley. She's the hospital librarian at Ellenville Regional Hospital in Ellenville, New York. This is considered a critical access hospital, and what that means is that this hospital will handle emergencies and will also stabilize patients to move them to a higher level of care. And the bed size there is 25. And I'm Mary Jo Russell. I'm the Knowledge Resources Librarian. I'm at Vassar Brothers Medical Center, and that's where the library is actually physically located. But I serve a 4-hospital healthcare system, formerly known as HealthQuest, currently known as Nuvance Health. And with those 4 hospitals together, we have a bed size of 628. And by the way, bed size is the way we determine the size of our hospitals. So it's not based on staffing or users or any other groups. It's based on the number of beds that we actually have to care for patients. So the 3 of us came together and we said, we'd like to take a look at this situation in these 3 different contexts: a single hospital, a 4-hospital system, and a critical access hospital. So what is it exactly that we are looking at? Well, our intent with this project was to comprehensively and systematically capture and track the types of research requests that come into us. How often do they come in during a given time frame? And the time frame that we chose was January 1 through March 31. Our goal was to tally the requests across these 3 hospital libraries and tally them in categories. We're going to create the categories of the search requests that we're going to use, and then track that just as a simple hand tally. Then we wanted to compare and compile those results. And then perhaps make some salient observations. So why would we do this? Well, ultimately, we want to show that the research service provided through our 3 hospital libraries have an impact on patient care, on quality of that care, and on the safety of our patients. And why in the world would that be so important? Well, that's because what resonates with hospital administrators when it comes to a service being provided within the hospital is the bottom line. And the bottom line is, does that service have an impact in patient care, quality, and safety? So that's really our ultimate goal. So when we started to work on this, our first step, of course, was to create the categories of requests, and that you would think would be pretty straightforward. But we ended up going back and forth with how we define those categories. In order to tally our research requests coming in, we needed to all agree on the categories. And although all 3 of us have been doing this for 20 plus years, it still was an interesting endeavor to come together in a consensus on the definitions of our categories. And then we went back and forth many times by email saying, where would I put this? Where would I put that? So that became an interesting endeavor as we tried to track and tally these things. And in different hospital settings, we end up with different types of questions. And we needed to come up with a way to track that together. So we started out with about 13 categories. And after much discussion back and forth, we trimmed it to 9 major categories. And these categories are as follows: patient care, which seems pretty obvious; patient safety, this is how well we care for our patients and keep them safe. And this could relate to a lot of different things, but are we using infection control processes in the right way, and questions like that. The third is policy and protocol. We also included guidelines in this. These are staff requests that are coming to us. They're either updating a policy, they want to include a protocol, or they're looking for a latest guideline in something. The next one is best practice. And this would be a question about how to best do a particular procedure or a particular protocol. So that's what made it tricky, because sometimes we would get requests that would say, can you find me information on best practice in the care of a patient, because we're updating a policy. So then where does that go? Does it go under best practice or does it go under policy? So we actually had to make that decision as we tallied these up. Another category is the college class assignments. We have many nurses who are advancing their degrees. We have a lot of staff who are going back doing different degree programs and taking classes, and often they will come to us for assistance and how to answer some of their class assignments. Presentation is a category in which we have physicians and others who might be doing a presentation, and they need some research in regards to that. The next one is publication. We have had a few that have decided to publish a case study or other research results, and so we help them out with that. Another category is professional interest, and this one is rather broad. If we have someone coming to us and asking us a request about research that they need done, it may just be that they have intellectual curiosity about something, or it may be one of our administrators who is looking to make a decision and they're not really sure and they need some information from us. So professional interest is one of our top ones. And last is continuing education. And this is where we have a lot of our staff are advancing their knowledge and how we care for patients through nursing continuing education, through medical continuing education, through residency programs. Those are physicians that come in and they're being trained. So those are the categories that we chose. So we went from 13, got it down to 9. And as you can see from our chart, what jumps out at us right away is when we look at the compilation of our tallies, we see that patient care is the one that has the most between January and the end of March. And that's really not a surprise. What's more interesting to us is that we see that many of the tallies end up dispersing across the other categories, across the 3 different hospitals. So it's not so much in the quantity of the requests, because we would expect that Ellenville Regional would have fewer requests because they're a smaller place, but it's more in the distribution, and we ended up with tallies in almost every category across all 3 months. But it's also interesting to look at the clustering of those requests coming in. For example, at Good Samaritan, Frank had a clustering of requests in the patient care areas and then professional interest areas. And then for New Vance Health, I didn't have a particular clustering of requests in any one category, but I'm working with across the 4 hospital systems, so I ended up with requests in every single category. I open this up to Frank if he has any comment on that.
Nope, So far, so good. You're doing well.
Oh, thank you.
Mary Jo, this is Carolyn. I just, there was one question came up in chat if this chart was from 2019.
This chart is for January 1st through March 31st of 2020.
2020.
Thank you for that question. I didn't put the date in there, but you're absolutely, yes, this is real time. This is real time. So when we look at this, we say, okay, what does this mean? What are our outcomes? So what? So what does it mean? Well, first of all, when we embarked on this, we thought that there had been others that must have done the same thing or maybe have tried to create the same comparison. There is absolutely nothing we could find in the literature that talked about comparisons of data on research requests between hospital libraries. Actually not surprised by that. We did find a few articles that were helpful and just in the concept, but not anything really specific to this. So for those of you who might be wondering if we have any references, the answer is no. Being typical librarians, that's probably what we look for, but we don't actually have any reference. So this is actually quite unique, we think. But given that, can we glean anything salient from these numbers? So, well, yes, maybe, and no. And that's why we have category of win, lose, or draw. Yes, in that we clearly see that research requests in patient care and policy categories are definitely the most frequent. And we would expect that to be the case in the hospital library setting. Not a surprise there. And yes, in that no matter the size of the hospital, over a 3-month period, we had requests come in under all the categories with pretty much the same frequency over those 3 months. No, and that it was difficult for some requests to fit into only one category. And in some cases, the three of us would say, hey, where do we put this one? And it didn't seem to fit under any category. So it's difficult to say, are the numbers perfect? Probably not, because what I might decide to put under patient care, Frank may decide to put under patient safety, Mary Allison might put under professional interest. So even though we have the definitions, it's still not a perfect world, and the tallies still might not be exactly the same. And then we had one category that I wanted to put in, and we started out with it, but we very quickly discovered there were absolutely no requests in this one particular category. And that category is committee work. Sometimes we'll get requests for people that are working in committees, and the committees are trying to make decisions based on their discussion, and they come and ask us for research. We didn't have any committee research going on in this past 3 months, so we took that category out. And the last is that, what did we really determine from this? So we think it's really a draw at this point. And the reason is that while we are focusing on this data, and while it may or may not be interesting or may or might not be helpful, it doesn't really answer the question that we really wanted to get at. And that is the question of the impact on quality patient care. And so we have this interesting set of data points. We have these categories. We've been doing this for just the first 3 months of 2020. So we can continue to track this over the next 6 months, maybe over the next year. And certainly we've had a little bit of a monkey wrench thrown into this because a lot of our research right now is about coronavirus. But at the end of the day, will it answer our question? So where do we go from here? And that's really the big question that we have. So what I'd like to say is that you should all stay tuned, and we'll give you an update at the April 2021 SunnyCon. So thank you all, and if there are any questions, Frank and I can entertain them.
Right. Mary Jo, there was one more question in the chat from Amy.
Okay.
Curious, did you perform a systemic review of it or a casual lit review? With the follow-up question, are you hospital librarians experts in system reviews? She's currently a self-learning systematic reviewer.
Systematic reviews are a really different animal, and they require specialized training, which we have not had. So we will do research to locate already published systematic reviews or a meta-analysis of a particular topic, but we ourselves do not get involved in doing systematic reviews. And it's not only because we really haven't had the training to do it, but also because systematic reviews are extremely time consuming. We would need to be able to do a deep dive into a comprehensive search of databases and literature on a particular topic, sometimes coming up with several thousand articles that would need to be sorted through before we would distill it down to the articles that the person who's asking the review would really need. So that is the reason, as solo hospital librarians working alone, we simply don't have the time to be able to put into a systematic review. So we will do our best to find systematic reviews already completed, but we don't do them ourselves. So thank you, Amy, for that question. Any other questions? Any other comments? If not, thank you very much for your attention to something that probably was quite a little bit of a different presentation in the mix today, and from a different perspective of a hospital library.